Do you ever experience nausea after sustaining a head injury or concussion? Maybe after a car accident? My name is Dr. Paul Hrkal. I'm a naturopathic doctor with a focus in concussion recovery. I want to break this question down for you, and I also want to give you some of the key solutions you can do right away at home to reduce nausea, even if you're still experiencing it weeks and months after sustaining a concussion. Let's dive in. So by now you've probably heard or read online that concussion affects the whole body, including the gut. And if you follow the lines here, you follow that red line going down to the adrenal system, which is our stress system, and that pumps out a lot of stress hormones that influence the rest of the body, including inflammation and immune cells, heart function, and you guessed it, the digestive tract. And there's immediate things within a couple hours that start happening. The lining becomes more leaky, the actual blood flow to the area changes, the peristalsis, which is the movement, the unconscious movement of the digestive tract can change and slow down, and this can lead to nausea. And this is exactly what this research paper that was published looking at Irish athletes and their recollection of symptoms digestively related that occurred after a sports-related concussion. And take a look here. Nausea and vomiting was found in almost 75% of athletes. And if you sustain a concussion, I'm sure you experienced, even sometimes right after you get that hit to the head, you get out of your car after a car accident, you get up from that fall or that injury, and you are nauseous. And there's some specific mechanisms that the body immediately kicks into gear to create that onset. So I'm going to walk through the top 4 here. Number 1, the inner ear dysfunction. This is your balance system, the vestibular system, if you will. And if this is off, you can become nauseous. Anybody that's experienced motion sickness, this is the system that's being affected. Number 2, the visual system. You can have visual system dysfunction. And this is, again, motion, moving around. You might experience challenges in moving your head. This can also be related to neck because your neck plays a really key role in your visual system. Number 3, the autonomic nervous system. This is the automatic or unconscious nervous system that controls things like breathing and blood flow and heart rate, all the things that you don't think about that keep you alive. And the changes, the immediate kind of fight or flight mode, the stress that you experience after a concussion can disrupt the autonomic nervous system and change the function of your gut, changing what's called gastric motility, the amount of, again, those smooth muscle contractions, and then even breathing patterns. And that can change the oxygenation and the carbon dioxide concentration in your bloodstream, which can absolutely trigger nausea. And then finally, just the stress of that particular impact. Oftentimes you're not nauseous immediately, but this might come on minutes or even hours later, for some people even days later. And this is because a person starts realizing, oh wow, this is actually more serious than I thought. I've sustained a concussion. I need to go get this evaluated. And that stress and anxiety kicks in, and that triggers some of the nausea centers in the brain. Anybody that's had the butterflies before a presentation knows about this pathway and has already experienced it. But with a concussion, obviously that's magnified. So for the visual learners, whoa, this is really complex. But I want to break it down for you because we have to understand what's going on in the brain. And so again, visually, let's look at the exact same thing. So here is in the middle, this is an area of the brain called the dorsal motor nucleus of the vagus nerve. You've probably heard about the vagus nerve. It plays a key role in connecting the brain and the gut. That's front and center what we're talking about today. But there's influences of that right away. The eyes, we talked about the visual system. They feed into that vagus nerve. Then the inner ear, the vestibular system feeds into that. Then actually your gut, so things like pressure and your bacteria in your gut, if your gut becomes more leaky, that can trigger nausea in itself. And then the autonomic nervous system, which I mentioned. These are those things that are controlling things like heart rate, breathing rate, and can change a lot of the chemistry in your bloodstream and the blood flow to your brain, which can also trigger nausea. And then finally, the higher kind of cerebral systems, the amygdala, the limbic system, these are where the emotions are processed. Stress, shock, and anxiety can also trigger nausea, and ultimately affecting the vagus nerve, which again disrupts this gut-brain axis highway and triggers nausea. So before I get into telling you what you can do about this, give this video a like and subscribe, share it with somebody that needs it. And if you're looking for more help for recovering from concussion, there's a couple options here for you. Check out the concussionfix.com for our online evidence-based blueprint for concussion recovery that you can do at your own pace and can guide you through some of the things that I touch on in this video and to address your concussion symptoms. Let's get into here what you can do about it. So if you sustain a concussion, you may experience nausea like those 75% of those Irish athletes. But the good news is that this is usually self-resolving in that acute phase. Did you know that concussion takes about 7 to 14 days to fully recover? But inside your brain, the chemistry can take up to 20 to 30 days to recover. So just because symptoms go away and you're able to walk around, doesn't mean that your brain's still not recovering. So there takes some time for some of that neurochemistry to resolve. But some of the basic acute evidence-based recommendations like doing light exercise within your threshold, not totally being in darkness and avoiding all screens, kind of getting back to your activities of daily living and getting your neck assessed and treated for the influence on the visual and vestibular system. A lot of people overlook the neck. What about if you've had symptoms for longer than 30 days? Now, this is where you have to do a little bit of Sherlock Holmes work and get after what's causing it. So I've given 4 of my most common things I've seen in practice. So if you get more nauseous after exercise, well, that means that you have to actually work on your autonomic system, which exercise is the key recovery piece. So staying under your symptom threshold is really important. Work with a concussion literate healthcare provider to guide you through that. What about if you're triggered by visual motion, like driving, working with a neurooptometrist, somebody that has a focus in neurology but also understands the eyes can be very helpful to address that particular aspect of nausea. Postural changes, changing your head position, bending over, dizziness. This is the vestibular system, and often there's physiotherapy that can be helpful to do what's called vestibular rehab. But here's a caution, be very careful. If you haven't addressed the neck, and if you haven't addressed some of the things we talk about in the Concussion Fix program, like your psychology, anxiety, mood disorders, vagus nerve function, this is sometimes a recipe for more symptoms because the foundations have not been fully addressed. So be careful. And what about other gut issues? So things like, have you had more gas and bloating after you sustain a concussion? Maybe this comes on even weeks and months after your concussion. You want to treat the cause, looking at working with a naturopathic doctor to rebalance some of those underlying issues can be really helpful. Diet is a huge component that sometimes makes a big difference. And finally, I want to share with you one of my favorite natural remedies, actually a botanical ginger that's been studied for hundreds of years and used as an anti-inflammatory herb. It's well known for its anti-nausea effect. And one of the reasons it does have that effect is because it helps move the digestive tract a little bit more. This is called a prokinetic. There's lots of research showing its benefit for nausea, especially induced by things like medications. So it's definitely worth a try. You can easily access it at a grocery store, and you can make this ginger infusion by peeling and grating ginger, about a 1-inch piece long, pour some hot water over it, and you can add a little honey or lemon juice to taste, and then just sip that as your own DIY anti-nausea remedy. So hopefully you found this video helpful and in understanding why you might be getting nauseous after a concussion and what you can do about it. Like and sub, and we'll see you at the next video.